what is one piece of advice you wish someone had given you when you were starting out?
So I started out in technology consulting in 1999 as a slightly arrogant but ambitious graduate from doing information systems management at Bournemouth University. But one thing I didn't do was I didn't listen very well. And I think this is a habit that we all fall into. When you're consulting and you're talking to stakeholders, especially senior stakeholders who are paying a lot of money for your services, it can be tempting to if you feel like you're on the back foot, it can be tempting to just fill the whole meeting or silence with facts and figures and knowledge, and to show how amazing you are in front of the client. However, the client is paying for you to be there because they want you to listen to them, to their challenges, gaps in capability, what they want to achieve from the piece of work. And too many consultants, and this isn't just consultancy, too many professionals in meeting situations with stakeholders, they just talk and talk and talk, and they don't spend the time to listen. And I've seen this backfire very, very poorly on some pretty stressful and high pressure client engagements. And so that's something that I had to learn the hard way. I wish someone had knocked me on the head and say, your job as a technology professional and a healthcare professional is simply to listen. And doctors do that very well, so we can learn from the industry that we work within. But yeah.
You share a pivotal moment in your career journey that has made a significant impact?
Yeah. Now, obviously I'm kind of like 3/4 into my career, but I would say one of the most pivotal parts has been relatively recent, to be honest. I, at the start of the outbreak, the pandemic, I was working in San Francisco just before the outbreak of COVID, and I'd secured a 12-month piece of work with a very large healthcare provider out there. COVID hit. All travel was cancelled, the project was cancelled, and I returned back to the UK, sitting at home twiddling my thumbs and wondering what to do next. So I contacted a CIO client of mine and friend of mine, the CIO in University Hospitals of North Midlands in Stoke, and I volunteered, and for 2 weeks I helped move cancer patients out of the hospital into the Nuffield site to basically get them away, because obviously they're highly vulnerable. And at that point, afterwards, he said, well, look, I can't afford your consulting rate, but would you like to stay as an independent contractor and just help me at this difficult time? And I said yes. So I joined. I was at the University Hospitals of the North Midlands in Stoke for 2 years. And why that was pivotal is that I was leading infrastructure, so networks and data centers, but I was also leading on a number of strategic projects, one of which was to increase senior clinician satisfaction in technology. It was really pivotal because prior to that point, I had worked in industry. I'd taken a couple of years out, but I'd never really had a sort of consumer, user, patient, clinician-facing role where the decisions that I was making on an hour-by-hour basis would have a real impact on people's working lives and on the health of patients, and especially at a very difficult time. And so what that's given me, I think, and why that's pivotal is, it's given me a whole new perspective on how to be successful in technology adoption, how to work with real world problems, how to work under pressure quickly, when, as we know, within healthcare, technology is becoming increasingly vital to that it's up and running and working correctly. So I really appreciated that. And that was really pivotal. So when I came back to consulting, it just gave me a new, fresh perspective on, the challenges and the pressure and the stress that are being faced every day, within the NHS, by my customers, and to be able to empathize with them and to be able to really understand, what they're having to deal with on a day-to-day basis, which is, a complex spaghetti of systems and unhappy users and, under-resourced and overworked environments. Yeah. Very pivotal, yeah.
Approach challenges and setbacks in your professional life, and what's your go-to strategy for overcoming them?
Yeah, I mean, I think the key here is, just not to, everyone makes mistakes. Number one, it's not to be too hard on yourself. That's how you learn, is you make a mistake. And as long as you don't make it 2 times or 3 times, you can move forward. So I think, the first thing is just to acknowledge that we all come into work every day to do the best we can, but everyone's going to make mistakes. So I think the first one is just don't punish yourself too hard. I think the second one is, to really seek help from those around you, your colleagues and your peers. But also 365, with people that are reporting into you. Because, often as we become more senior within organizations, we start to think we are the smartest person in the room. We become very inward looking, but it's often the people that you're working with that see the real you and can offer very, objective feedback, can help you with their experiences and can bring a different perspective, because and this is personal growth challenges, career challenges, but also technology challenges. I'm not always going to have the answer, or if I do have the answer, I'm going to be blinded by my 25 plus years of experience and my very sort of narrow set of experiences that I've had. Whereas, if I have a big team of excellent people working around me, like I'm lucky to have at ATOS, for example, they can help me solve any challenges and problems and provide coaching. And like I say, the coaching doesn't have to be provided by someone that's a peer of mine or someone that, I look up to as being more senior. It can come from the most junior levels of the organization, because often all you need is a fresh perspective and someone to be able to allow you to see more clearly and get out of your head and approach problems from a different perspective. So very much, I think it's just about not internalizing things and looking to people for support, and understanding who the right people are to provide the right level of support. And, I will always do the same to my colleagues if they're also, experiencing, career challenges. Don't take it on all by yourself.